So we are starting with the second last session. Now this session is related to the Rajasthan, and uh, we can. This session will be the presentation will be by Dr. Priyanshu Mathur, and this will be followed by a panel discussion. So I would like to invite panelists beforehand only. So I invite Dr. Gayatri to the dais, Dr. Swati Mehta, Dr. Bhanu Pratap Singh, and Dr. Ram Singh Yadav. Please join so we can have the experience from you about the Rajasthan. But before that, we go with the presentation of the rare disorders in the Rajasthan, especially in the eastern belt and Jaipur. So Dr. Priyanshu. Dr. Priyanshu is a professor of pediatrics at as J.K. Lon Hospital as part of the SMS Jaipur, and he has established genetic services and metabolic disorder clinic, and is also part of the DBT project. So gradually, that is also developing as a center of excellence for rare disease and the part of Rajasthan government initiative for rare disease management.
Thank you very much, sir, for the kind introduction. So I will take only few minutes. I will describe about the nodal center for rare disease, which was designated by state government in 2021. So J.K. Lon Hospital is being the first hospital in country where rare disease clinic was established in 2014. So we got order from our principal and controller SMS Medical College in 2014 to start rare disease clinic, which was fully functional by 2016, and it was first healthcare facility which was running weekly rare disease clinic since then. J.K. Lon Hospital is a multidisciplinary facility with 895 exclusive pediatric beds, having 295 state-of-art NICU beds, 88 PICU beds, 40 pediatric emergency beds, and 105 pediatric surgery beds. And it caters around 4 lakh OPD patients. I'm talking about only pediatric patients. So, and around 50,000 IPD patients per year. J.K. Lon is serving around 2,000 to 2,500 patients for rare disease yearly. So around 40 to 50 rare disease patients visit rare disease clinic per week, and they are suffering from various disorders. You all know about the name of the disorders. So in 2016, we started a rare disease only for registry for J.K. Lon Hospital. So in 2021, Government of Rajasthan has announced Center for Rare Disease J.K. Lon Hospital as a state-level nodal agency for rare disease patients. So Government of Rajasthan has launched Raj Sambal portal that was already described by Dr. Lokesh. This was launched in August 2022. Then 12-bedded rare disease facility was started, but because of COVID, this facility was given to that was converted into a ICU. So rare disease team at J.K. Lon Hospital is imparting education and increasing awareness among healthcare professionals. Then in compliance of Honorable High Court order, so we are currently treating 9 patients with risdiplam for spinal muscular atrophy and 6 patients with imiglucerase and valaglucerase for Gaucher disease. So apart from these, few patients are under charitable access program. So around 8 patients are getting therapy from charitable access programs. And we treated 4 patients of spinal muscular atrophy with AAV-based gene therapy. So first patient was treated on May 21st, 2021. So these patients are showing very good response after gene therapy. So newborn screening. So we initially started newborn screening in 2018. We got funds through a CSR funding, and we did for around 25,000 newborns. So then we also got sanction for establishment of DBT Nidan Kendra for newborn screening of genetic disorders. Then for expanded newborn screening, recently we got the machine LCMS platform that got installed, and already we have done, we have processed 90 samples first batch. So we are also working in collaboration with Central University of Rajasthan, and we are working on some projects to develop indigenous drugs or molecules and low-cost diagnostic and therapeutics. So state government is taking a step to start Department of Medical Genetics at Jaipur under SMS Medical College. Then state government is planning to have a CSR summit also to motivate donors. So these were a few orders which regarding nodal state level nodal center, Jekyllon Hospital. This was establishment Priviti Nidankin. Then we have some research collaboration. This was the order in 2014 only. We got an order to start a rare disease clinic. So these were few trainings we got from out of the country, and then we already published two books on rare disease and one atlas. So total 3 books already we published to increase awareness. We are getting some of a very ultra rare patients also. Like we have few patients with alkaptonuria, orotic aciduria, progeria, Sanfilippo disease, Morquio disease, Ulrich CMD, serine synthesis defects, creatine transporter defect, dysferrinopathies, and one important point is hyaline fibromatosis. So which is a very ultra rare disease. So we got 3 patients in a month. This is regarding Rajasthan crowdfunding portal. I'm not covering it because it is already covered. So this was the so in last year budget announcement, we got sanctioned the Department Center of Excellence for Medical Genetics. So that is Department of Medical Genetics, and we are expecting that this department will be functional in next 15 days. But it may take around 15 days, maximum 1 month. So then next was the government has sanctioned 50 crore rupees for rare disease fund. That was for treatment and as well as financial support, electric power wheelchair, and free bus pass, roadway bus pass for patient attendant. And Mukhyamantri Ayushman Balsambal Yojana was started, 5,000 rupees support. So this was the project which was submitted to government for Department of Medical Genetics, which is sanctioned. And recently we got some posts for medical genetics department. So these posts are sanctioned. If anybody is interested, DM genetics from AIMS Jodhpur and want to join Jaipur, they can come, or you can communicate to your colleagues also. So these posts, assistant professor, senior resident post, will be very soon. These posts are going to be announced within next 15 to 20 days. This was sanctioned by state government. Yeah, one point I want to emphasize that again, the state government decided to start genetic testing on PPP mode. Okay, so on PPP mode, all the genetic tests, including whole exome sequencing, whole genome sequencing, MLPA, karyotyping, FISH, prenatal sample testing, everything will be done on the PPP mode. So the project is already ready to be floated. I think so government has decided that machine should be installed in-house, but the operation will be in public-private partnership. So this was that proposal that government is going. The state government is going to start genetic testing facilities. And next, we applied for Center of Excellence, and the team from Ministry of Health and Family Welfare, the expert panel already visited us, and they had given some observations. So we are trying to comply with these observations as quick as possible, and we are planning to resubmit our proposal. So this was a meeting, this was an extensive meeting which was taken place in SMS Medical College, and they decided to strengthen the services for rare disease patients, and they took care of all the deficiencies which were found in our center. So this is our recently started LCMS and MS platform. So this is fully functional now, and the responsibilities was given to 5 of our doctors to have a smooth running of this particular platform. For karyotyping, we also started in-house under a research project. So karyotyping is already started. Cytogenetic studies is started. Mukhyamantri Ayushman Balsambal Yojana we already covered in detail. So government is very keen to start newborn screening program. So our Chief Minister of the state already decided to start universal newborn screening program for the state of Rajasthan. So I think in this budget 2025, we will get this announcement. And this will be started from the 6th मेडिकल कॉलेजेस ऑफ स्टेट ऑफ राजस्थान, जो 6 मेडिकल कॉलेजेस हैं, जो पुराने मेडिकल कॉलेजेस हैं, वहां से न्यूबॉर्न स्क्रीनिंग प्रोग्राम को इम्प्लीमेंट करेंगे. देन इट विल बी phase 2, it will be expanded to entire the state of Rajasthan. So this will be universal newborn screening program for, and it will include congenital hypothyroidism, adrenal hyperplasia, G6PD, and hemoglobinopathies. And again, recently, the government also decided to start division of fetal medicine at Mahila Chikitsalaya, which is under SMS Medical College, Jaipur. So we are doing some awareness program also. So thank you very much. Thank you.